Hello and welcome to the program. I'm your host, Neil Howard. Thank you once again for joining us here on Health Professional Radio. In this segment, we're going to have a conversation with Jeannette Bankes. She's joining us here, President and GM Global Surgical Franchise at Alcon. Alcon is a global leader in eye care. She's joining us this morning to discuss sustainability and Alcon's recently released Environmental, Social, and Governance, or ESG, commitments and their 2021 Corporate Responsibility Report. Welcome to Health Professional Radio, Jeannette Bankes. Thank you for taking the time this morning.
Thank you, Neil. It's a pleasure.
Well, I mentioned your position there at Alcon. Give us a look into who you are and what it is that you do.
Thank you, Neil. So I'm the president and general manager of the global surgical franchise at Alcon. I have the pleasure and responsibility of being able to have oversight to the entire surgical portfolio. So for the healthcare professionals out there, as you think about any type of surgical treatment, whether it be front of the eye, corneal, LASIK, and or intraocular lenses, your patient has cataracts, or the back of the eye, retina, for unfortunately those diabetic patients that might need our assistance in the back of the eye. I have the pleasure of being able to help innovate, ideate, and bring commercial products to the world to help in our vision of helping people see brilliantly.
How prevalent are eye problems? Is it really a huge problem, not just as we get older, but in our younger years as well?
Absolutely. I'll lean in as a parent and say a lot of times we're saying to our children, please get off your iPhones, make sure you're looking in the distance. It's an actually increased prevalence and problem around the world. I'll give you a statistical fact that maybe most Americans don't know if you're sitting or residing in the United States is China's actually declared this the third biggest prevalence and emergency to the country. They have really high myopes. And so traditionally you might have sat in a class and saw 1 in 5 or 6 people wearing glasses. That phenomenon is probably at least 50 or greater percent. And with an aging population, in the VA, you might see the cataract patients. There's over 30 million cataracts that we treat around the world as manufacturers. We believe that's going to grow to almost 45 million in the next decade. So the prevalence is increasing. Eyesight is probably one of the most critical senses you have. And unfortunately, some of our environmental habits, et cetera, are causing us to have poor eyesight at an early age.
Now, I did mention that you recently released an environmental, social, and governance, the commitments, ESG commitments. What does ESG entail when it comes to eye care, eye surgery, and eye health?
Okay, well, thank you for the question. You are right. We just released our corporate responsibility report. If you take a look at Alcon's mission, we are one of the global leaders in eye care. And with a vision, and no pun intended, of helping people see brilliantly, that's an improvement in lifestyle, how we live. But we also have a focus on strengthening our communities and creating this long-term value by innovating products to improve sight. But as you think about innovation, we also have a strong commitment to enable communities to access critical eye care. So we play a very big role globally in making sure, number one, you have the technology that you can access. 2, you have the healthcare provider that can actually do the procedure. And then third, as people think about ESG or sustainability efforts, we also focus on the planet and communities we live and serve. So we have a very big focus on emission and waste reduction. Mm-hmm. And we also, as the largest global leader, have a responsibility in reducing environmental impact of our products that we manufacture, because we do manufacture almost 90% of the products we put out. So we have both a vision of helping you see brilliantly, but also live brilliantly in the planet that we serve.
Talk about how Alcon is actually addressing emissions and waste when it comes to eye surgery.
Thank you. So what we outlined in our corporate responsibility, there's really 3 areas that we focus on. I think I spoke to actually brilliant living, so being able to help people see brilliantly. But as you think about innovation and where we're innovating, step back and think about we have a choice every day in how we innovate, the products that we innovate, the technologies, the materials that we use, and the way that we distribute. So as you think about that innovation, we are really thinking about our carbon emission, our waste, what we're doing to both help the procedure but help the planet. Some of the critical things we outlined is a lot of people are focused on carbon emissions. We've declared and are taking a focus and effort to really think about how do we reduce our carbon footprint We've actually declared by 2030 that we'll become carbon neutral across our global operations. That's a major effort, but we're focused on that. The second thing is, as you go into an OR, if you're a healthcare provider, you're thinking about all the waste that you generate. We're working on that. We're working on packaging, the size of packaging, the actual the materials we're using to package. But we also own the facilities around the world, own the responsibility to think about the waste we're generating. So we're also declaring that by 2030, we'll divert 100% of our non-hazardous waste that we generate or manufacturing, and we'll keep those out of landfills. So we're thinking about environmentally friendly ways to operate, and then also deliver products in your operating rooms that are sustainable in nature as well.
Now, I understand that this initiative is called Greenest.
Greenest, yeah.
Greenest.
Yeah, I'm glad you know about our Greenest initiative.
Talk a bit about some of the unique challenges that healthcare organizations face with what you're discussing, sustainability, waste and emissions reduction, and single-use medical products.
Okay, so I'll hit the first because I would love the audience and listeners to understand, well, it's a great marketing Greenest. Everybody can grab around that. The surgical franchise is really focused on, and I mentioned a couple of them, is how do we think about opportunities that are sustainable where we reduce waste for our products? A good example, and a lot of people can understand this, is you use foam to package. And so our team set out to say, okay, there's a lot of foam that we use to actually secure the products that are being shipped and make sure that they're perfect for performance when they arrive at your OR. We went to a friendly green cell foam. We eliminated around 12,000 pounds of waste and more than 100,000 of styrofoam annually. So there are alternative Greenest type products we can use when we think about distribution. We also, from a healthcare provider, and everybody knows this in ORs, we are responsible for putting in directions for use in our boxes. We've been able to go electronic around the world. So as you can imagine, all the booklets, the amount of carbon dioxide usage, the paper waste, et cetera. They're just kind of examples where our footprint and the way we choose to distribute is changing to be more environmentally or Greenest friendly. But, you ask about what are the challenges in the healthcare organizations when we think about trying to achieve a more environmentally friendly footprint is we have to decide. So go back to the time in our brains when we're thinking, how do we actually solve for a clinical problem? And we develop a product doing that. As we start to journey down, how do we actually bring that product or technology solution to the market? We're thinking about, do we do it in a reusable manner that automatically you think in the brain, and I'll speak to this, is more environmentally friendly, or do we choose to use a disposable? And from early, what we call ideation, we have to think about a couple things. We think about, can the product do what it's intended to do in a safe manner? That choice will help you bring an algorithm or a decision around, is that disposable or is that reusable? In the back of the eye, we have very, very small. I've worked across a couple specialties. This is probably the most engineering challenge to try to bring a probe or a device at the back of the eye that can, number one, get through all the sterilization to be sterile. Number two, make sure that if you're reusing it, you can wash it properly, get any type of cellular debris out of it. We're really thinking about the performance and safety of the patient with the caveat, how do we create a product that's environmentally friendly? So we have a balance in our portfolio of reusables and disposables with those type of things in mind. If we do choose to do a reusable, which some of the areas of the world are saying, hey, bring us more reusables, we really have to think about the caveat. Can we track, that it's been sterilized properly? Is it best safety for the patient? And is there an alternative way in a disposable that our footprint of carbon, materials, et cetera, is actually better? So that's a constant challenge for manufacturers trying to answer for both performance and sustainability.
Is there anything that you'd like to add? And then give us a website where our listeners can learn more.
Absolutely. Sean, we appreciate the opportunity to partner with your listeners. I think the thing that you can count on Alcon for and a commitment is that we will continue to spend time and energy in helping people see brilliantly in an environmentally and safe manner. So Alcon's been seen as the leader in ophthalmology. We'll continue that leadership in both innovation and environmental sustainability. If you want to reference any of our materials, reach out to Alcon. You can reach us at www.alcon.com. We'd be more than happy to partner with you. And lastly, from a gratitude for the world, thank you for allowing us to help people see brilliantly, because while our innovations come from this company, the hands and expertise of the healthcare providers that we serve daily and the patients they serve is why Alcon's been successful. We appreciate that partnership.
Jeannette, it's been a pleasure speaking with you. Thank you so much for joining us here on Health Professional Radio.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Jeannette Bankes. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com Health Professional Radio.